again. Now, we've established that racism is a serious threat to the public's health. Racism is a system consisting of structures and policies and practices that assigns value and determines opportunity based on the way people look. Racism has a tremendous impact on social determinants of health, and these social determinants of health are the key drivers to health inequities. You may have heard the saying that your zip code has a greater impact on your health than your genetic code, and this is true. Where you live, your socioeconomic status, and the way you look influences your access to quality health care. In a study review from 2016, it was found that some physicians were significantly more likely to recommend white patients for bypass surgery rather than black patients due to the physicians' beliefs about their black patients and the patients' follow-up activities. Other examples of bias include healthcare professionals and nurses believing patients were faking pain for sickle cell disease, for instance, or school mental health professionals allowing black youth to be more aggressively restrained, or even in the treatment of addictions with more of a criminal focus for communities of color and a health or medical focus for white communities who they might identify with. Now, have you heard of the Flexner Report? The Flexner Report basically codified racism and bias, and it contributed to the physician shortages and minority representation in the medical field. Now, as a result of that, right now, only about 5% of all physicians are black. So bias in healthcare looks at not only bias in how patients are treated, but also representation of who is in the healthcare field. Now, these things may contribute to a cycle. There's a cycle of mistrust by patients of the healthcare system and a cycle of mistreatment, consciously or not, of patients by providers. Regaining that trust may include increasing representation of Black and Hispanics in the medical field and intentional cultural humility training and the training for all healthcare providers. Now, can we train health professionals to treat social problems? Will it be more impactful to partner with communities to address food insecurities rather than scold patients that they need to eat better? So ask why, or even ask how. How can we train our healthcare workforce to treat people according to their needs and not our bias? Implicit bias. There may be mistrust of those that don't look like you. Maybe even unconsciously harboring negative stereotypes about others. Well, biases affect our perceptions and our policies. Our policies when hiring or providing business loans or in city planning, in the severity of sentencing in our court system. And yes, bias definitely affects how we treat patients. So what about dismantling racism? Well, again, we know that racism is a root cause of health inequity and social determinants of health. So strategies include both understanding one's own biases and addressing systemic racism. With our own bias, we need to build awareness through workshops and trainings about the harms that biases have inflicted. Seeing situations from another person's perspectives, like what does it feel like to be negatively stereotyped? Also, seek out situations and relationships to be exposed to all the many positives of diverse communities. And in addressing systemic racism, that requires addressing policies and laws, our voting rights, our environmental protection, and our diversity, equity, and inclusion in hiring practices. So what could health equity look like? Well, health equity describes a system that supports a high standard of health and healthcare for all people. To achieve this, people would need to eliminate sources of health inequity and provide people with care based on their needs. This means giving more power and resources to groups that have less, rather than just treating everyone the exact same way. So in the healthcare system, this could involve affordable prices for medications and vaccines, flexible appointment times for people who work long hours or unusual hours or have a difficulty taking off from work. In our healthcare system, we can also examine more mobile health services for those who live in remote areas or people who can't travel or don't have access to reliable transportation. Also, easy access to translators and care workers and community health workers and others who can help people understand and access medical care. Now, achieving health equity also involves a societal change, and this could involve financial investments to areas and groups that need it the most. It also involves cleaning up environmental pollution and instating laws to protect against the environmental pollution. Addressing problems with accessing healthy foods and food deserts. Addressing barriers that prevent people from attending school, known as maybe short-term period poverty, where there could be a loss of a job, relocation, and requiring students to change schools in the middle of a school year. Another societal thing that we can do is ensure that all houses and workplaces are safe and accessible, as well as prohibiting exclusionary housing practices. And even ensuring that there's access to green spaces and parks and trails for exercise and free options for physical activities. Addressing these systemic changes will impact health outcomes and help to reduce the racial disparities that we see. So this picture might be familiar to some of you, if you're familiar to the work of Norman Rockwell. He's portraying a young girl named Ruby Bridges as she attempts to attend school at the very beginnings of school integration in her state of Louisiana. Now, it took her courage, as well as a systemic change with government support. Now, will we continue to see racial inequities in who lives and who dies? Well, only if we refuse to value the lives of everyone, and only if we refuse to welcome everyone to have a seat at the table. So I'm glad that we are taking a more critical view in why we see racial disparities in our healthcare system. Let us all continue to do what we can to make things better for everyone. Thank you.